to kick off the National Health and Nutrition Examination Survey, an effort led by the Center for Disease Control and Prevention Division. This initiative aims to collect vital information that is used to help guide public health and health policy. And as a local health official for the city, along with some of my constituents here in the room that represent other cities, it is vital for us as well as we aim to promote, prevent, and protect the residents in our cities that we serve, in our towns. So today we have several individuals that will be speaking. I would like to invite at this time Dr. Nguyen, our CDC Regional Medical Director.
Give me a round of applause. Thank you.
Wow, thank you everyone. Thank you, Maritza, for inviting us out today. I want to express my appreciation for everybody to come out today. I want to spend a little bit of time to explain to you what the National Health and Nutrition Examination Survey is, otherwise known as NHANES. So we'll talk a little bit about its importance in public health and why we're so happy to be here in Fairfield County partnering with everybody. So NHANES is the only national health survey that takes information from health interviews and physical examinations to really get a good picture of today's health in America. NHANES is supposed to represent everybody in America, young and old, male or female, it doesn't matter. Every race, every ethnicity, every single income level. Each one of those groups has its own health challenges. You need to be able to capture those health challenges and really examine the health disparities that exist in this country. So what's the process? What is NHANES and what do we do? So as you know, as I just said, Fairfield County has been randomly selected. Within the county, we have selected communities randomly, and within those communities, we have selected homes. Those homes have received or will receive a letter informing them that their home has been selected. After this point, after a couple of days, a health interviewer will be knocking on those doors to invite them to be selected into our survey. If a participant is selected, they will be scheduled for a health interview and then scheduled again for an appointment at our mobile exam center. Now, our mobile exam centers are going to be located conveniently at the Trumbull Marriott. Every single mobile exam center team consists of a physician, a dentist, health interviewers, health technicians, and very skilled lab technicians. Lab tests will range based on your age or your gender, but for the most part, everybody's going to get height and weight measured. They'll have blood pressure measured. Based on your age, you may have tests such as bone density to look at osteoporosis. You may have your hearing assessed. And of course, everybody will have an opportunity to have laboratory testing to check for liver functions, kidney functions, cholesterol, and environmental exposures such as lead. So now you know what's going on, what NHANES is. I want to tell you and go into a little bit of detail about why it's so important and why it's such an important piece of public health in America. You know, we talked a little bit about how NHANES has been doing this since 1960. And over this time, we have tracked the prevalence and the trends for obesity, high blood pressure, diabetes. But in the 1970s, NHANES data showed that over 95% of people living in the United States had really high lead levels. This data led to immediate legislation that led to the removal of lead from gasoline and household paints.
Interesting.
Just 30, 40 years later now, we know that that level in America is about 3%. That's an astonishing 94% decrease in lead levels in America. So if you think back and look at it, it's incredible. It's incredible that decades ago, when people were doing this in the 70s, did they realize how important their participation would be? Did they realize that what they were doing would impact our health and our nutrition today? No, nobody knew that. It's so important for participation, and that's why we're so pleased to be partnering with everybody today. A couple other issues or a couple other things that NHANES has been impactful for in this country. Every day, pediatricians like myself look at pediatric growth charts. It's how we track and monitor the growth and development of our children. That data came from NHANES. NHANES data has been used to explain the importance of fortifying foods to decrease birth defects in this country. I can go on and on and on. But the crust of this is that NHANES participation is so important. And so we are so excited to be partnering with Fairfield County. Everybody has been so welcoming and so open that I look forward to working. Thank you.
Thank you.
Let's give him a warm round of applause and welcome him to our city. So at this time, I would like to also invite up to the podium our Commissioner of Public Health, Renée Coleman-Mitchell.
Hi, everyone. I can't tell you how excited I am because as Commissioner of the Department of Public Health is extremely rooted in science and in data. So I am literally salivating right now to know that there's going to be data taken from the state of Connecticut, Fairfield County, city of Bridgeport, because the work that we do is grounded and found in the science and the data. And to just hear what Dr. Nugent said, it just really, I really want to jump up for joy. I'm just containing myself right now. And what you guys don't realize, that this is a very, very big deal. He said it was random. I say it was fate. That we definitely have this opportunity to get some really good data here representing Connecticut, a major city in Connecticut. This is huge. So this is a very exciting day. I'm going to step back now, and I'm going to get a little napkin to wipe the drool that I have to know that there will be exquisite data coming from a major city here in Connecticut. Thank you.
Thank you so much, Commissioner. I will be remiss if I don't invite our other health officials up, so if you can come up to the platform also, so that you can just be acknowledged, because this is not a just one city effort, this is definitely a county effort, and you guys are my colleagues, so I just want to make sure you are up here supporting. So with no further ado, all the way from Hartford here, also supporting this initiative is our Lieutenant Governor, Susan Bysiewicz.
All right, so thank you so much for your leadership. It's a pleasure to be in the beautiful city of Bridgeport, Mayor, and Commissioner, thank you so much for your leadership. We're so proud to have you on our very diverse and talented team. And I'm pleased to be here because nationally, our state, our little state of Connecticut, is one of the top-ranked states for the health of our citizens. But we know that there is so much more to do. And we know that some people have great access to health care in our state, and some have no access or less access. So I'm happy that Fairfield County was randomly chosen. But if you were to take a microcosm of Connecticut, Fairfield County would be that microcosm because it is, our little state has very large urban centers like Bridgeport and Stamford and Hartford and New Haven, but we also have small rural towns, we have suburban communities, we have mid-sized cities. Fairfield County has all of that. So if we had to take a snapshot of Connecticut, Fairfield County could be that, especially because Fairfield County has some economically challenged municipalities like Bridgeport, and we have some municipalities that are doing really well. So we are happy that the federal government has chosen Fairfield County to be one of their test centers, if you will. Now, I have been traveling across Connecticut trying to get the word out with the mayor, with the senator and Representative Steinberg and so many elected officials, both municipal and state, to get the message out that the 2020 census is coming. And the 2020 census is critical because the numbers of people who are counted are going to determine all kinds of funding that is going to impact our state and national health, because it is funding for school lunches, for Head Start, for SNAP, for Medicaid, all of the things that are going to impact the health of our Connecticut citizens and our United States folks as well. And really what this survey is going to be for Fairfield County is like a health census. And so it is important for everyone who is selected to participate. And that's why Commissioner Coleman-Mitchell and I are happy to be here to help get the message out that it is safe and important to participate. And I know that because of some of the conversation that's been going on nationally with respect to our census and the citizenship question, there may be some people who are a little reticent or a little afraid to open their doors and to have that conversation with someone who's representing the federal government. And that's why I am here to lend my voice, because this is important information. You have heard how national decisions about healthcare have been made as a result of this data. And I'm here to say that the state of Connecticut is going to be using this data as well. And how are we going to use it? Well, the commissioner is going to use it for public health purposes, and the Governor's Council on Women and Girls, which I'm very proud to co-chair, and have each of our 27 state cabinet leaders participating, as well as our legislative leaders. We are going to be using that information in our public health subcommittee to make good, sound health policy decisions at the executive level. And I know that the senator is going to be using that along with our legislative and Representative Steinberg as they lead health efforts. They're going to be using that data to make solid, good, sound, forward-looking, and progressive healthcare policy for our state. So I thank you so much for the opportunity to participate.
Thank you. Our Lieutenant Governor shared some really pertinent points, and as health officials, how we develop strategic priorities are exactly from the data that's collected from these surveys. And so we really want to encourage our residents to take advantage of this. One of the things, the next person I get to introduce, prior to becoming the health director, I really was admiring our city of Bridgeport leader for the quality of life efforts that he has made a commitment to in our city and the support that I get as a health official. So with no further ado, I would like to introduce our mayor, Joseph P. Ganem.
Terrific thanks to you and to the other health directors, representative from the CDC, to our commissioner for your excitement too, as well as your leadership. By the way, the president of city council is here as well, Heidi Nieves, and she's always been supportive of this and other initiatives. Our senators, thank you for your constant commitment and leadership and partnership. And of course, our tireless Lieutenant Governor, who on this and so many other issues has traveled and continues to travel around the state, not just on awareness, but commitment, helping to make things happen. So I give them all a round of applause and thank them. Welcome, a warm welcome to the city of Bridgeport. My comments are brief, but we sat down a little bit before this, and health is could be such a comprehensive topic. I was actually asking, we're talking about what we're doing with water and with air and all that. Of course, all that matters. Our health director here may have challenges that she's advanced in public safety here that might be slightly different than other communities. But when we come around the focus here about our human health, about an assessment of ourselves, about the challenges that we need to understand, the knowledge that we want to have, I'm so happy that however it was selected, that our city and our county, Fairfield County, has been selected, and that we can help to add value to the understanding of what we can do to make ourselves collectively, ourselves, our families, and our communities as healthy as possible. I thought when you were talking about seniors, some of the challenges they have, and we all have, it could be high blood pressure. I guess you don't have to be a senior to have high blood pressure, right? Cholesterol, all those things, dementia. What are some of the causes or challenges of that? Maybe in some small way, some of this knowledge can help with that. And then the flip side, when you talk about lead paint, things like that, I thought about young people and that next generation, and what can we do in the areas that be preventive, and how this can help us collectively. And we can look ahead to see how we make this our city, as I think, our county, our state, but globally, even our country, with sometimes we can do better in knowledge in the areas of health, how this is going to help us in that area. So thank you so much. Welcome again to the city of Bridgeport. With our Lieutenant Governor, let's launch this as well as she launched the census. Let people know this is friendly, this is information that will help, and not to be afraid of it. Let's make it very positive. Thank you so much. Let me get back to you.
Thank you, Mayor. So in addition, we talked about the importance of this survey because it really influences health policies. And so the next several speakers that I will be inviting to speak are individuals that are influencers at the state level as well as the local level. So with no further ado, I would like to introduce to you State Representative Jonathan Steinberg, Public Health Co-Chair.
Thanks very much. I think the Lieutenant Governor hit it on the head by saying that the CDC couldn't have gotten luckier by randomly choosing Fairfield County because it is such a remarkable microcosm of disparities. And as we know, disparities in healthcare are usually related to other disparities, economic and various other opportunities. But this is an opportunity not just for the federal CDC program, but for the state of Connecticut to benefit from hard data. You've heard the commissioner, she salivates when she talks about data. I sweat. So I'm as excited by this prospect as she is. One of the things I'm most proud of, I'm a little damp, be careful, is that one of the things I'm most proud of as chair of the Public Health Committee is the creation of the Office of Health Strategy here in the state of Connecticut, which is to be our repository of data and the place where a lot of great strategic thinking comes. When we think about public health, we're talking about not simply prevention or amelioration of disease or epidemics, but also education and access, things that are critical for people taking control of their own health. And I'm very hopeful that this data will lead us in certain directions, not simply trends of disease and conditions, but also opportunities, whether it's eliminating food deserts, whether it's looking at ways for people to find productive exercise and other healthy lifestyle changes. This is just the beginning of what I hope will be an ongoing dialogue at the federal level and the state level, so we can help all of our citizens, whether you live in Bridgeport, where I was born, or Westport, where I grew up and live now. Everybody should have equal opportunity, and I'm hopeful this data will lead us in that direction. Thank you.
Thank you. Thank you so much, State Representative Steinberg. I had an opportunity actually to work with Steinberg at the state level to address our sugar tax initiative, because we know that high sugar levels also impact health, and so it was a pleasure working with you on that effort. And hopefully future data can continue our efforts with the fight against high sugar substances. Our next representative will be our state senator, Tony Wong from Fairfield.
Thank you, Marissa. It's great to be here in the great city of Bridgeport, which is part of Fairfield County, but also recognizing that Fairfield County encompasses as far north as Danbury, as far south as Greenwich. It is an incredible microcosm, as stated earlier, of our state. That being said, I think it is very, very important to look at the random process, the independent random process in which people are chosen, and in speaking with Dr. Nguyen, to talk about the deliberate process of making sure people are informed at first, and that every precaution is to reassure them of their privacy and their participation in this process. I think the other critical thing related to randomness is the fact that nowhere in the presentation, nowhere in the questionnaire, do we talk about any racial data disaggregation. I think that's critical. This is a process to collect health data that can be used, for illustrious Commissioner mentioned in her enthusiasm. But the important part is there is no disaggregation of this data along racial lines. And I think the third and final point that I want to raise is, in this climate, it is imperative to give every reassurance, and I think Dr. Nguyen reassured through the CDC and the NHANES program, that this is respecting of federal HIPAA laws and the painstaking efforts that the organization has undertaken to protect data privacy. So I think it's important for people, as we launch this program, to give reassurance. The randomness, the protection that they have of their identity, but collection of critical information and health data to make us better. When you bring up the example of the 70s and the lead poisoning solution, this is my hope that we can find through this data collection solutions to possible pockets of breast cancer that plague us in our community, but also so many illnesses and efforts to solve them. So I'm excited to be part of this process, but I also want to take a moment to reassure the greater population, participate in this, because this data will help us, but we're going to protect your identity, we're going to protect your safety, we're going to protect the sanctity of your data. Thank you, ma'am.
Thank you so much. So at this time, we also have our council president. Did you want to say a few words? No, oh, good. So I think also what I wanted to add to this point is that participation also comes with an incentive. And so oftentimes when we're having community conversations in our city, it's important to also value the time that people take out to participate. So this effort can lead up to $125 per person for participating in this health study. And so we ask our residents to visit the www.cdc.gov/NHANES so that you can get information. Dr. Nugent and his team will be out knocking on doors, inviting participants to be part of this effort. And so we ask individuals to please open the door if you have an individual coming in with a CDC badge. They're there to invite you to participate in this effort. And then also to ensure that the participation, again, is going to be confidential and that no information will be shared with others other than the participation with CDC. At this time, I wanted to ask any of my health officials if they want to come up. No? Anything else that I left out, Dr. Nugent?
Why
Okay.
don't you just say what towns are the health officials?
And then I'm going to actually just allow my health officials to introduce themselves because they're here with me.
Deanna Diamore with the City of Norwalk.
Mark Cooper, the Westport Weston Health District, the Director of Health.
And I'm Director of Health for Naugatuck Valley Health District, which covers Shelton, Connecticut. My name is Jessica Stalmagic, also a Fairfield County resident.
Thank you all for being here, too.
And so at this time, I'm going to open it up for any questions that the press may have. Yes?
In our 15-second social media world, what do you want to tell the audience and what advice do you want?
You hit it? Okay, I'll hit it. So in 15 seconds or less, we would like to invite Bridgeport residents to take part of this National Health Survey. It is a confidential, and participants can earn up to $125 each for their efforts in ensuring that we collect the proper health data that we need. I felt like a commercial.
If there are other questions.
You sold it.
Okay, wonderful. Thank you so much for being here.